And it looks like we're have a bunch of people coming in now, and I think we have all of our speakers and our chamber presidents. So why don't I go ahead and get us started? And thank you guys so much for joining this town hall today. My name is Ashley Deasing. I'm the Director of Strategic Programs at the Greater Washington Board of Trade. I'd like to take a moment to thank the chambers who partnered with us to organize this meeting. Gaithersburg, Germantown, Greater Bethesda, Greater Silver Spring, and Rockville. And before we get started, do you guys want to share a few words with everybody? Marilyn, Allie, Jane, Margie, whoever wants to.
Sure. Marilyn Balcom, Gaithersburg, Germantown. Thank you all for coming. It's been a great partnership in the past 15 months. Couldn't do my job without my colleagues and peers. I want to thank Jane for suggesting that we do this in Montgomery County. So thank you, Jane.
Well, and I'll jump in really quickly, and I want to thank the Board of Trade for its flexibility, because when we first got the email, these were going to be Board of Trade events, and we said, well, we'd like to do something that's geared toward Montgomery County and include some of our Montgomery County folks as the speakers, because we have experts in Montgomery County on all these topics as well. So I want to thank the Board of Trade. And again, I'll echo what Marilyn said. I couldn't have done this past 15 months without my colleagues, because we've done so many things together. We all learned Zoom together, and I think that we're all better for it. We're very much experienced in doing our legislative and advocacy efforts together, but we learned some new ways to work together, and I think it was to the benefit of all of our members and all of us. So thank you, everybody, and thank you again to the Board of Trade. Thank you, everybody, for joining us this morning.
Margie?
Just well said, ditto what my colleagues said, and we're happy to bring this to you. And congratulations, Andrew, on your award from Montgomery County Chamber.
And good morning, everybody. My name is Allie Williams. I am the President and CEO of the Greater Bethesda Chamber of Commerce. Excuse me, I echo exactly what my colleagues said. I come out of the U.S. Chamber and in the Association for Chamber of Commerce Professionals, two big national associations. And I will tell you, this is a unique thing to have 4 presidents and CEOs of local chambers of commerce within a very tight geographic area. We collaborate, we work well together. I'm fortunate to come into this job in January, but having known Marilyn, Jane, and Margie for the past 20 years in my experience with the other chambers, and it is truly a gem that we are able to kind of get together a lot, share, collaborate, discuss, and work with folks like Councilmember Friedson on pro-business legislation. We love doing these joint activities, and we are thrilled that all of you are here today. We are recording, so it'll be a great opportunity to share some of this rich content with our members throughout the next couple of weeks. So to the Greater Washington Board of Trade, we thank you. This is an amazing morning, and we're excited to listen to our experts. So thank you.
Yeah, thank you all. I echo that. I really appreciate your continued collaboration together. It really brings the region closer together. And the Board of Trade certainly appreciates our longstanding partnership with you all and the other chambers as well. All right, so we want to make sure that all of our participants have plenty of time to ask your questions and you leave here well informed. I have a few things I'd like to share before we jump in. Just a really quick background on why we're here. The Board of Trade at the beginning of the year stood up a cross-sector regional vaccine information task force made up about 30 individuals who are at the front lines of both the public health response and pandemic-related business hardships. And through our discussions, we really determined, at the near term, it would be really important to educate business community on vaccine information, legal and HR issues, and why the vaccine program is so critical to our economic recovery. This is our second town hall in this series that we are developing in partnership with the chambers across the region to make sure that we can really reach deeper into the business community. And just a few housekeeping items before we get going. As Allie mentioned, this is being recorded. We intentionally wanted this to be an intimate group of people so that we encourage you to ask your questions throughout the presentations. It's not a webinar. This is a forum for you to be able to ask your questions, so our experts can answer, of course, to the best of their ability. So make sure you use the raise your hand feature or the chat box, or you can wait until about 9:15 when we open up for Q&A. All right, so today I am pleased to welcome Councilmember Andrew Friedson, who represents District 1 on the County Council. He serves on the Council's Planning, Housing, and Economic Development and the Government Operations Committees, and is the Council's representative on Montgomery County Economic Development Corporation Board. During the pandemic, Andrew worked tirelessly to develop a variety of small business relief programs to help business and nonprofit owners keep their lights on. After we hear from Councilmember Friedson on his work during the pandemic and where Montgomery County is in terms of vaccinations and other pertinent information, we'll hear from Mike Neary, who's a shareholder at Lurk, Early and Brewer, where he practices employment and labor law, as well as all types of civil litigation. Mike helps businesses in Maryland, DC, and Virginia comply with the ever-changing employment and labor laws. Mike will walk us through some best practices and how to handle some specific scenarios that businesses are likely to encounter as we return to work. And to round out the discussion, we're joined by Dr. Christina Stashik, Cigna's Senior Medical Director. She's recognized for her work in both addressing health equity and leadership development. Dr. Christina has been extremely strong advocate and initiator for this chamber education series to increase knowledge and awareness about the pandemic and vaccination. She also serves as a member of our vaccine task force that I mentioned earlier. Thank you all for being here with us today. And with that, I will pull up your slides, Councilmember Friedson, and turn it over to you.
Well, Ashley, thank you so much. Thanks to the Board of Trade. It is great to see so many friends and partners at our Montgomery County local chambers, and a lot of friends on this call. And I will say this is a panel of a legal expert, a healthcare expert, and me. So I will try to make up for my lack of expertise with some positive thoughts and a good amount of energy and optimism. But before we get into the slides, I just want to appreciate everybody on this call, particularly the chambers, the Board of Trade, many people who have joined, who are members of some or all of the groups, really have been at the forefront of working with us as partners to get through this pandemic. We recognize that this has been an awfully challenging time for local businesses, some industries hit harder than others, some residents and families hit harder than others. And ultimately, it has been a team effort, and I'm just really grateful to have been able to work so closely with our partners and advocates of our partners. I talk a lot about how our business community are the partners in government that allow us to pay for all of the priorities that we share, and this group really embodies that, and today's program really demonstrates that. So I just wanted to offer my thanks and appreciation. With that, I have a very specific a couple areas that I was asked to cover. So we'll start with the vaccine progress, start with the good news. The good news is we said from the beginning that if we just get the shots, if we just get the doses, we will get them into arms. And that has been true in the late stages of this. True largely with when 12 to 15 became eligible, we finally were at the point where we had enough doses for people who actually wanted them and could deploy our infrastructure, and both in the private and the public sector. In Montgomery County, more than half of the 12-year-old to 15-year-old eligible residents, we have about 40,000 of them, were vaccinated in 1 week. More than half of all received a dose in 1 week. It shows that once we got those doses, we could do it. We've been saying that. I think we have since proven it. The percentage of eligible population, 12 and older population, who have received both shots or one shot of the Johnson & Johnson is 72.7% of the population. Remember, 12 to 15-year-olds just recently were able to get it. It's a really significant number, almost 3/4. That's the highest rate of any jurisdiction in Maryland. And as of June 4th, early June, which is this became available last week from the CDC, publicly available. We have the highest rate of any large county in the U.S., actually medium or large size county in the U.S. Of jurisdictions, 300,000 person population or over. I think a significant accomplishment for all of us, our residents, our healthcare professionals, the public and the private sector. No individual entity is doing this alone, but that's reflective of lots of residents who want to get the vaccine. So we're getting the information out like this program is trying to do, and also actually effectively getting them out to the people who want them. Percentage of total population with 2 shots or the 1 shot Johnson & Johnson is almost 62%. That's the highest rate of any jurisdiction in Maryland. Remember, we have about 13% of the population in Montgomery County who are not eligible. They're under 12 years old, cannot get a vaccine. We're hopeful, we'll hear a little bit more from an actual expert, but hopeful that that will change come late summer, early fall potentially. But as of right now, we're working with a pie of 87%, give or take, in terms of the population that's eligible to get it. So 61.7%, where we currently are, is pretty good. And those are the folks who've received both doses, not just one shot, the single shot. The reason why I'm using the CDC data and not necessarily the county and state data, the county and state data, which comes from the Maryland Department of Health, does not include out-of-state shots. And understandably, the CDC does not include only the first dose, because presumably you could get a dose in 2 different places and there would be a discrepancy of where that data gets calculated. If you got your first shot in Florida, your second shot in Maryland, you know, where does the CDC count that? So they count total US population first doses administered, and then they break it down by state and beyond, by county, et cetera, by the second dose that you receive if you're receiving one of the 2 dose options. Just a point, you know, 65 plus has been the longest age-based category, obviously, that's been eligible. We're at 90% there. 89.7% are effectively fully vaccinated there. That's the second highest rate of any jurisdiction in Maryland, Howard County. Slightly ahead of us, but we're basically similar to Howard County. But it does show you, and I think it speaks to the hesitancy. We were concerned early on about the hesitancy. We're still concerned about the hesitancy, but in some ways, there's less hesitancy in Montgomery County, frankly, than there is in other places in the country. There are some, and some is too much. And so we need to make sure that we're getting the information out and working with partners like you to help us do that. But that number, 65 plus, shows you 90%, and also the fact that, in terms of the 12 to 15-year-olds, that, 50% ran to get the vaccine, so to speak, in that first week to get the first shot. So, we're doing better than almost any other jurisdiction in the country, and our numbers reflect that as well. Not just our vaccine numbers, but our transmission rates. We have some of the lowest transmission rates of any jurisdiction in the country when it comes to test positivity, when it comes to case rates. We are well below where most others are, and we are way below where we were. We were in very dangerous territory, even as recently as late January, where we could almost, see the possibility of our healthcare system being overwhelmed. And now we're in, a really good and positive place. Still need to monitor it, but obviously can get closer to normality. Next slide, please. All right, so that's the good news. The bad news is there were some restrictions there for a while that had a significant impact on a lot of local businesses. And, I take that really seriously. Those who followed the council, I felt like there were certainly things that we needed to do to keep people safe, to keep workers safe, to keep businesses safe, to allow businesses to tell their customers that it wasn't, them putting in restrictions. It was the government, so to speak, as a matter of public health and safety. I had been pushing for a metrics-based system for a year, time in and time out, privately and publicly. We did finally put in place a metric-based system that was based on the rate of vaccines. As of May 28th, we've now a few weeks past, but it went into effect where 50% of the total population had received, had been fully vaccinated. I pushed hard to use the CDC guidelines because, from a public health standpoint, we shouldn't care where somebody gets vaccinated. We should use the most appropriate and accurate data available. And so on May 14th, that Friday, the CDC reported that 50% of the population had received a second dose or a first dose Johnson & Johnson, single dose Johnson & Johnson. 2 weeks later, they'd be fully vaccinated. So that was put into effect, and there are no more county restrictions. The county now follows the state. The state doesn't have any major COVID restrictions specifically that are in effect. Those were phased out virtually completely on May 15th, and prior to that were largely eliminated several weeks before the county ultimately did it. Next slide, please. Just a quick rundown of the face coverings, because I think this has been a real challenge for a lot of residents and a lot of businesses, confusion of what the rules are and what everybody should do. Things have changed fairly rapidly. The county's following the CDC and the state and Maryland Department of Health standards. Face coverings must be worn inside public transit, schools, healthcare settings, childcare facilities. Face coverings are recommended for individuals 2 and older who are not, and those who are not fully vaccinated. And face coverings are recommended outdoors at childcare, school, and camp programs when physically distancing isn't possible. And a couple important notes. One, the county recently announced we are in county facilities following these standards. County came out with new rules on our face coverings in our buildings, but largely conforming to the state and CDC guidelines, which was new and separate from the restrictions and the public health orders, Board of Health orders. And then the last piece is I have tried to make very clear that businesses and facilities are allowed to implement their own face covering requirements. I refer to it as like a dress code. The government can require that you can't walk around naked because of indecent exposure, and that is what the government does. Any business can say there are certain, you must wear a jacket to come to dinner. And obviously it's different wearing a jacket than wearing a mask when we're talking about a global pandemic. But in terms of what the rules are and what a business has the right to do, it is the same. Any business has the right to require it as long as they require it for everybody and is administered in a legally appropriate way. Next slide, please. I think that's it. So that's where we are. I think it's a really positive indication of how far we've come. I point out at the end of January, we were at a case rate of over 50, which meant we were having over 500 new cases a day. Now, most days we're below 10 new cases a day. Some days slightly above 10, some days slightly below, but we are well below it. We have been below the standard metrics of what you're looking for in terms of case rate and test positivity. You want to be below 10 for case rate, below 3 for test positivity. We've been consistently below those for more than a month, and we continue to monitor them to see where things are, but we have allowed the vaccines to catch up to the case rate, and we hope that we will continue to do that. And I'll just say it's a testament to businesses that stepped up despite huge sacrifices, residents who worked really hard to hold each other accountable, to hold themselves accountable, to take care of themselves, their neighbors, and we're in a much better place than most, and we're in a much better place certainly than we would have been but for them. Thanks.
Thank you, Councilmember Friedson. I appreciate that. Mike, I'll turn it over to you if there's no immediate questions.
Yeah, good morning, everybody, and thank you all for being here today. And the data that Councilmember Friedson laid out has caused some tricky employment issues in the workplace. kind of unique to our area, given how much our area has embraced the vaccine. And so what I hope to do just really quickly, because I know we don't have a lot of time this morning, is just highlight some key issues that everyone needs to be thinking about in their businesses, some employment issues as they contemplate how to approach the COVID-19 vaccine. And so the first scenario I'll just talk about jumps off the data that was just presented, and that dovetails with a constant theme I've been hearing. So when the vaccines first rolled out, most employers kind of took the approach of, we are going to strongly encourage the vaccine for our people. We don't want to mandate it. We don't want to get into the thorny issues related to individuals with disabilities or individuals with religious objections to getting the vaccine. And let's just do a strong push, a recommendation. And given that data, that's been enough for a lot of businesses, because our area in particular has really embraced it. So they're having, a lot of my clients are having high percentage of individuals who have taken the vaccine. But a unique twist that's come up now as the vaccine is rolled out and people are really starting to come back to the workplace is individuals who are saying, I'm not coming back, because there are individuals within your organization that are not vaccinated. And so a lot of businesses are now coming and asking the question and turning the cube over of, should we go with the mandate? We need our people back, and we only have a few stragglers who aren't doing it, and we have some folks who don't want to come back unless there's a mandate. And so I'll walk you through kind of the brief overview of how you would implement a mandate if that's what you wanted to do. The prevailing view in the employment world is still that mandates for the vaccine are allowed, provided you have a pathway for individuals to stick their hand up and say, I don't want to get this because I'm allergic to one of the ingredients. I've got a disability or a medical condition, or I don't want to get this because I've got a sincerely held religious belief. And so if you wanted to go down the road of a mandate, you would want to develop a policy that articulates why you're doing it and identifies clearly for your employees what they need to do if they want to request an accommodation to that policy. And you want to have your managers trained up on what to do if you get an accommodation request, because you can't sit on something like that. You've got to act quickly and engage with them. So questions I've seen in that process come up is, okay, does this person really have a disability? Is there really a reason for us to give them an exception to this? And so there are mechanisms under the Americans with Disabilities Act, which would be the primary law that would apply in the state and county counterpart laws, that allow you to inquire further. I always advise to tread carefully there, particularly when you're talking about the vaccine. But if you want to go down that road, if you think someone is just trying to abuse the accommodation process, they don't have to get the vaccine. I think you want to reach out to your advisors, whoever that may be, and walk carefully through how to go about asking for additional information. If somebody comes forth with a request for an accommodation based on a religious belief, Title VII, the federal law Title VII of the Civil Rights Act of 1964, and as well as the Maryland and state and county laws, they really have narrow pathways to challenge somebody on that, because the idea is, how are someone's religious beliefs are difficult to really get to the heart of. But if you do have questions again about an individual may be abusing the system and not really, have a sincerely held religious belief, there are ways to ask further questions. But again, it's a precarious pathway to go down. And so you really want to have either a highly skilled HR person on board, or you want to be reaching out to an advisor who knows kind of the mechanics of how to do it. And I unfortunately can't give you kind of like a canned way to do it and just set you off to do it on your own, because in each area, the disability accommodation laws and the religious accommodation laws, it's so fact specific, so individualized to that person who's coming forward that you really have to act carefully based on what they're telling you and what their documentation is that they're coming forward with. So I've seen more businesses going down that road of rolling out mandates, particularly a lot of the schools that I represent. I have a lot of private schools that I represent, and they have unique challenges as they look to reopen 100% in person next year. And so they're starting to roll that out for their staff, but also their vaccine eligible students. And so I would encourage to set forth a policy if you want to go down that path. Try to communicate with your key stakeholders before you do it, because once again, you know, you could be faced with unexpected consequences if you roll that out, because you might have individuals who have strong beliefs that they're not going to get the vaccine, and it might not be tied to a disability or religious view. And if you have a true mandatory policy and individuals aren't going to get it, if you can't, you know, it's a position that can't be kind of a work from home position, you could be in a position of telling some folks that they can't work for you, then they might be very valuable employees, which was why I think a lot of businesses early on did not do a mandate. They did the hard push because they didn't want to be faced with those challenging questions. So some other issues that have come up recently, you know, surrounding the vaccine is really how can we, okay, we've done our hard push. How do we gauge how many people have been vaccinated? You know, are we even allowed to ask that? Doesn't HIPAA apply and prevent us from asking? Luckily, we have some pretty good guidance from the government on this. First of all, for most private employers, the HIPAA law doesn't apply. It applies to healthcare entities and entities that process healthcare payments. The primary law that governs the privacy of health information in the workplace is the Americans with Disabilities Act. And so there is a law that prohibits businesses from collecting and disseminating health information. But the federal government gave this guidance that basically said asking if someone's been vaccinated is not a medical inquiry, which, you know, common sense, you're scratching your head because it seems like a medical inquiry, but they said, no, it's not. So you can ask. What you're not supposed to do is go further and say, okay, so you're not vaccinated. Why not? Because that now is eliciting potentially medical information. So what I advise is that you have a point person for those types of questions. You make it clear that they understand the sensitivity of the information, that the information should be kept separately from normal personnel files, and that the information should be elicited privately so that you're not going to be in a scenario where someone replies to all on the email chain. You want to have a filter mechanism so it goes to that individual only, and that statistics are maintained that decision makers can rely upon for alleviating maybe social distancing or masking requirements within the workplace, but not necessarily identify who the particular individuals are that are not vaccinated. I would keep that as close to the vest as you can. And so you can ask those questions. And if you don't, what I recommend is if you don't get responses from some, you follow up with them and say, re-ask the question in a week or two. And there could be some people that are just not going to tell you, and that's just put them down as a no. I think that's a safe bet when you're doing your planning. I wouldn't push anyone to kind of disclose if they're not comfortable, particularly if you get a high percentage of individuals that are telling you that they've been vaccinated. But there's nothing wrong with asking. So just quickly, another issue that's coming up now that the mask mandates have been lifted is Councilmember Friedson noted, businesses can maintain the mask mandate and within their own establishments. And so the tricky issues arise is when, if ever, are you going to roll it back? And so what employment lawyers have been advising throughout the pandemic is to rely on the best available public health information. And for a long time, it was the CDC Then the state of Maryland and local officials were issuing public health guidance, which was great in terms of planning purposes. And so I'm of the belief that we're still in that recommendation still holds. You should be relying on the best available public health information when it comes time to be lifting the mandates for your own space. And it could dovetail with your vaccination records as you collect that information. If you have a 98% or 90% vaccination within your workforce, and you're not a public-facing organization who's welcoming members of the public, the question then becomes, okay, is it time to lift the mandate? And what I worry about is if individual businesses keep the mandate for their employees, and they keep it in a way that says only those who are not vaccinated have to wear the mask. To me, the concern would be if those individuals have the disability accommodations in place or the religious accommodations in place, is your policy now effectively targeting those individuals, which raises some complicated potential employment risks. And so every organization has to do what's right for them. It's going to involve communicating with your employees, your key employees and your leaders, trying to get a broad, maybe survey your employees to get a sense of how people's comfort level is if you lift the mask mandate. But eventually, I think the further we get, the further we continue to drive this pandemic into the ground, the less business justification for a mask mandate there will be. And if that business justification continues to go, to dwindle, then if you have individuals who claim that your policy now targets them because they're not getting it, the vaccine, if you have a mandate for only those who don't have the vaccine, your policy is targeting them because of their disability, it's harder to justify that and defend against that type of a claim. So all of this is very complicated stuff and changing. And so I commend all of you for being here to kind of get the basics. I'm happy to answer questions in the chat or offline on the nuances of these particular scenarios. Throughout this pandemic, businesses have really been forced to change on the fly and to really adapt to some difficult situations. And so, hopefully we're turning the corner, as Councilmember Friedson laid out, and one day you won't have to think about all this. But I think that's the basic 10,000-foot overview that I can give in this short amount of time, and I'll turn it over to Christina, I think, for some further thoughts.
Mike, before we move on, there was a question in the chat about the mandating employees to get vaccinated, which you pretty much touched on, but it said, can you mandate your employees to get vaccinated or provide a negative PRC each month?
So in terms of the testing, I would think, I think there's the concern I have about that is as the numbers continue to dwindle. So the guidance early in the pandemic from the government said you could test. And so if the public health emergency lifts, I anticipate that guidance will change because it really implicates it was a public health threat. It was a threat to the workplace. So there's an exception in the Americans with Disabilities Act for direct threats to the work environment. And I would say if you want to do that, you got to think through kind of the public health reason for it. Does a once a month test really, given the nature of COVID, does it make business sense? Because ultimately, if that is challenged, the business rationale for it must be pretty sound. And so I would consult with, to the extent you have medical professionals advising you on something like that, I would want you to look at literature on that and be able to point to it in the event that there is a challenge. So right now, I think you can do that, but I don't know how much longer that would be the case once the public health emergency lifts.
And does that go along also with other screening types like, temperature checks and other measures that people have been taking?
Exactly. So that's been the rule of thumb throughout this pandemic, is that the genesis of saying that was okay, because that was a sea change, right? You would never go to your place of employment and expect to have your temperature taken. The genesis of that was really the declaration from the government and the World Health Organization that this is a pandemic posing a direct threat to this health and safety of individuals. And so if that abates, either locally here or nationally or internationally, the rationale for that may go away. So a lot of this is not set it and forget it, unfortunately. I think it's going to be changing over time, hopefully for the better.
Great. Thank you, Mike. Yes, Dr. Christina, we will turn over to you now.
Great, thank you. Thank you so much. And Council Member Friesen really shared an amazing statistic that 72.7% of adults in Montgomery County are vaccinated. When we were thinking about community immunity, the numbers between 70 and 85% were those that were quoted. And Mike, I don't know if this poll question is allowed or not, but I'm going to put it up there for a number of reasons. One, I want to define some of these groups and the questions that they may have. One, you're considered fully vaccinated if you have been if it's 14 days after your last shot. So your second shot for Moderna or Pfizer, first shot for J&J. If you have an appointment, yay, let's get that shot. If you need to make an appointment, there are now a national clearinghouse and resources where it's very easy to get an appointment. You either visit vaccines.gov or you text your zip code or you call. But that last 10-15% in Montgomery County that still need to get vaccines still have questions. And I want to address many of the questions that I've been hearing and why it's important to get the full complement of the community vaccinated to ensure that we prevent further outbreaks of the COVID vaccine. So how do we get to community immunity? There are two ways to get immune. One is you can get an infection, but that gives you short-term immunity. You can get complications of the illness. The death rate has decreased as we've learned about the disease. But the big negative about getting the infection is the variants. What's been happening is because so many adults are getting vaccinated, the virus is going to the unvaccinated population, the adults who've remained unvaccinated and now adolescents. And we're seeing an increase in the number of adolescents that are getting sick, but we're also seeing in the UK and in India, the Delta variant that's transmissible. It has 3 mutations. This is not a local disease. We're focusing our comments on Montgomery County, but what happens in India and the UK definitely ends up in the US. So if you're looking at a risk-benefit ratio, do you want to get infected or do you want to get the vaccine? With the vaccine, you don't get sick. And it protects those that Mike outlined, those that can't get vaccinated either for personal belief or medical reasons. We may need booster shots. We're still trying to figure that out, and people may actually have some contraindications to that we're discovering. So let's talk about some of the illnesses and the long-term effects. So if you want to gauge, do I want to get sick or do I want the vaccine? We are seeing long-term effects of COVID-19 from individuals that actually got sick to it. Most commonly, chronic respiratory conditions, the post-pneumonia conditions, nervous system things like the brain fog. People, they can't think as quickly. They need to think much longer about things. They're just not back to where they were. We're seeing heart disease, particularly in the 40-year-olds. So important for the 40-year-olds, if they're not getting vaccinated, think about getting vaccinated. And I'd be remiss if I didn't talk about the mental health impacts from the pandemic, not only from the COVID themselves, but the isolation, the impact of businesses not being opened, all of the rules, that's had a significant impact on mental health conditions. And as employers, one of the things you need to keep an eye on is the fear that people have about coming back to work, the fear of not having their questions answered if they're vaccinated and others are not. Does it put them at risk for bringing the disease home? So some of those things that Mike talked about, important to consider. So when it comes to COVID-19 vaccine, what are some of the questions that we're still getting? Are they safe? Yes, they are. How much will they cost? The vaccine is free. Our tax dollars have paid for that vaccine. There should be charges for the administration of the vaccine so that the healthcare professional who has personal protective equipment on and has to get the syringe, they get reimbursed for that. But that is covered either by the health plan or there's a public fund to cover for that. But we're also getting other questions like, do I still need to wear a mask? No, not if you're vaccinated. Do I need to get the vaccine if I've had COVID-19? And the answer to that is yes. But if you're currently sick, you need to recover, wait about 14 days until your symptoms, the first day that you're symptom free, before you go out and get vaccinated. And is the vaccine effective against the new variants? In the US, yes. And it also is effective so far that what we've seen against the Delta variant in the UK. So what are the vaccines that we have? There are 3 vaccines available now, and there are minor differences amongst them. Pfizer is the only one at this point approved for those age 12 and above. So if you have an adolescent and you want your adolescent to get vaccinated and you go to your vaccines.gov site, filter for Pfizer only to find who's administering that for your adolescent. Moderna still requires 2 injections 4 to 6 weeks apart. They have applied to be provided for those 12 and above, and J&J also. 1 shot, you're one and done. It is for those 18 and above. All of the vaccine manufacturers have indicated that they are applying for full approval, and Pfizer's already indicated that they're going to be asking for approval to be administered for those age 6 and above by the fall, so in time for the school season. So that's kind of the current state of those vaccines. Things to know: if you are vaccinated, you don't need to wear a mask, you don't need to get tested after exposure, you don't need to physically distance yourself 6 feet from others, and you don't need to avoid crowds. You're vaccinated if you're safe. If you are not vaccinated, you still need to wear the mask and get tested after you've been exposed and look at physical distancing and avoid high risk, especially indoor settings. Outdoor settings are a lot safer. There's more room. The COVID virus is airborne, so there's a wind and there's sun. But if you are vaccinated, you're fine to go about your normal daily activities. We talked a little bit about mental health. Really, one of the things that you should be talking to your managers about is to help them recognize people who are struggling with mental health. Talk to your EAP or your behavioral health carrier. Help them, help your managers understand the words or put into words what they're seeing so that they can refer your employees to mental health services. Really can't stress this enough. This is a huge part of the COVID pandemic. Now, one of the other questions I get is, I'm not going to get vaccinated. This isn't a vaccine that's safe. It got rushed through. The FDA process is very, very diligent. It tests the process at every step of the way and every piece of the development of the vaccine. Operation Warp Speed put full resources onto developing the vaccine. The FDA stopped the progress as the vaccine went on if they had any questions. So was this rushed through? No, it wasn't rushed through. But why did it get out so quickly? One, all the government's resources put money to these development of the vaccines. The scientists, the lab workers, the administrators, this is all they focused on. They didn't have any other projects. 100% of their time was focused on developing the vaccine. Two, since prior vaccines were developed, technology developed, shortened the time of getting answers to the questions. And typically, what usually takes a really, really, really long time to get the vaccine to market is getting volunteers to be in the phase 2, phase 3 efficacy trials. Well, during this global health emergency, it was really easy to get 40, 50, 60,000 volunteers that included a variety of age, race, gender, chronic disease conditions. So that typical delay, it usually takes 2 years to get volunteers, that was shortened into 6 months. So these vaccines, tested, safe, effective. Question is, well, why are they emergency use authorization? The difference between an emergency use authorization, and full authorization is the amount of time that people are observing the vaccine. Well, with over 100 million individuals vaccinated, there are more people that have gotten this vaccine and have been observed for a period of time than the fully approved vaccines that have been released to date. So these are very safe. They've been tested. There's a lot of data to show that this is really going beyond the normal standards of approval. Some of the other questions I'm hearing is, will this alter my DNA? Is it
Christina, sorry, you're muted. I don't know how that happened. There we go.
Can you hear me now?
Yes.
Okay, somehow I just got disconnected. So the questions I get is, will this change my DNA? Will I shed the virus? None of these vaccines change the DNA. None of them affect the woman's reproductive system, so it doesn't affect your fertility. And two, because there's no virus that's provided, you cannot shed the virus. So the vaccines work by providing a small piece of the virus that stimulates antibody production. And what happens is Pfizer and Moderna, they provide the instructions to our bodies to create that little virus piece, to create antibodies, and then the vaccine gets destroyed. J&J puts that little piece onto a piece of an adenovirus, and that stimulates antibody production. So there is no live virus provided. It's just kind of having a twin. So it's like putting a picture of you into the body. The body recognizes that picture. It's not the whole virus to create antibodies. So very safe. Who should you really be concerned about? We talked about who got hit hardest. We know that those that got hit hardest are the Black or African American population and the Hispanic, as well as the American Indian population. Hospitalizations and deaths were significantly higher there compared to the white population. We're not seeing a lot of vaccine hesitancy in these populations. What we're actually seeing is difficulty to access the vaccine, because if the pharmacy closes at 5 and they work until 5, or there are no pharmacies in the zip code where they live, they can't get to it. So again, for employers, make sure that all of your employees have time to get the vaccine. What we're hearing is individuals are afraid to get the vaccine because if they get side effect and they need a day to recover, they won't get that day to recover. So please, employers, work with your employees to have time for the vaccine and also for time for recovery. What are the side effects if you had this? Basically very mild. You may get pain at the injection site. You may get sick for a day that you're exhausted. Very rare to get an anaphylactic reaction. An allergic response where you're wheezing, you get a rapid heart rate. Those individuals need epinephrine, and if they've gotten that reactions, they actually should be getting that at a doctor's office that can handle those side effects for the second shot. The CDC also has an app called vSafe. So we ask everyone to sign up for that, because that is how we're finding, once we're giving millions of shots, those really rare side effects. And right now we heard about the myositis in adolescents, and we're looking at the data, finding that it's actually a little bit higher in those that have been vaccinated, but the numbers are still very small, so it's safe to get vaccinated. Some of the challenges employers that you may want to help your employees who have not been vaccinated yet is help them schedule the appointments. Uber is giving free rides. You can actually, the Board of Trade has Uber on its vaccine board that you can get a free ride, help them get time off to work and find those vaccines. Who should not get the vaccine? From a clinical perspective, it's those that have had an anaphylactic reaction. If you have cancer and you're getting treatment, oncologists want those patients to get vaccinated, but the timing is very specific. So if they're going to get the shot, they really need to work with their oncologist. So what else is there that we need to help people make well-informed decisions? It's one, keep attending talks like this, encourage safety measures for those who are not vaccinated. People need to talk to their doctors if they have questions to get information. Facebook is not a great place to get information. Most news sources aren't really great places. Talk to the doctor for personalized information and ask questions. We're here to answer those questions. So thank you for your time, and we still have time for some questions. So open it up. I don't know if there's anything in the chat, Ashley, but.
Allie, did you want to say something?
Excuse me, I did. You just kind of hit it on the head, Dr. Christina, when you mentioned that people are getting their news from all kinds of sources, and sometimes that's the power of the loud and the court of public opinion, as we all know. So I've been hearing from my members, and actually had a little conversation yesterday with our local magazine, the Bethesda magazine, Bethesda Beat, about what our retailers and restaurants are seeing, and some of the other companies and businesses in and around the greater Bethesda area, as far as whether or not they will mandate the masks within their own business. Of course, some hospitals and healthcare and other providers, as we mentioned earlier, are doing that. But what will happen when the person who has been 2 weeks past their second dose absolutely, hopefully doesn't have a conniption when they have to put their mask back on to go into an establishment? Obviously, they can do other things and go other places, but a lot of times scenes are made. It's educating our communities and so forth. But I was just wondering if Councilmember Friedson or Mike or you, Dr. Christina, have some advice that we can share with our members about respect, and these companies are doing this for a reason. When they want the masks to continue, some buildings, some other apartment buildings and foyers and areas that, people aren't wearing them on their wrists anymore. People don't really have them in their pockets anymore. They're just going out. Elevators, can we stuff 19 people into an elevator now? So I just wanted to kind of get thoughts on, maybe especially Mike Neary on the labor and employment side, but Councilmember Friedson, what are you hearing? And Dr. Christina, what should we be sharing with our members?
So I'll start from the clinical perspective. Until we get to community immunity, or what some people call herd immunity, when you're out there, you don't know who's at risk or who's going to be going home to caregive for someone who's at risk. And until we get to community immunity, if a business, based on whatever reason they decide on, ask you to put on a mask, just do it. I mean, really, you don't know who you're going to impact, and we are in this together.
And certainly common sense indicates that, but I have physically seen people like calling their attorneys because they want to sue a local, I won't say the name, but it rhymes with CVS, about having to wear their mask inside.
Right. And just in terms of, from my 2 cents on that, I mean, you really want to train up your workforce on de-escalating situations as best as possible. You know, when the mandate's not there, you know, I was in church during this, and there was an incident where there was somebody was without a mask, as the police were called while the mandate was in place, and the police dealt with it. But since it's not a legal requirement anymore, it's really on your employees. And you know, training to be able to de-escalate. And at some point, you know, you don't want to get into a physical altercation with anyone. So if someone's really going to be a jerk about it, I would certainly not advise any sort of physical confrontation. Sure. You just have to, you know, step back at some point. But it is your right to have that mandate, and then it's a matter of whether your customers will comply with it, and then, or they'll go elsewhere. I mean, that's always their choice as well.
Yeah, the only thing that I'll add to that, Allie, is we faced this during the whole pandemic, and it was anything that was confusing made it impossible for businesses to communicate, and anything that was clear cut and consistent across government entities, state, federal, local, tended to be a lot easier to communicate. And now we've created this new level of confusion, and something that I've been concerned about. I don't disagree with what we're doing. It follows the science, but I have been concerned about it. I have tried and have pushed the county to include in all of our messaging that businesses still retain the right to require masks in their facilities. And I think that it's important that we all work together to make sure that that information is clear in any communication that we have. I've also personally and just anecdotally found that when you have a sign or some specific guidance when you walk in, it's like body armor, so to speak, for the employee. They have something to turn to that looks official, and it doesn't look like they're arbitrarily picking on a particular customer because of, you know, who they are, or, you know, perhaps what they look like, or because, you know, they just feel like picking on somebody. This is the rule of the business, and it's posted on the sign out front. I am hoping that this dies down a little bit, but I think no matter what, there are always going to be, you know, a relatively small number of customers that make a big issue out of this. And, you know, I think that as much as we can help to communicate better on the front end, and then I think for businesses, and maybe this is a role for the chamber was great about, you know, doing message campaigns with masking during the pandemic, you know, in the heart of it, when it was a restriction, you know, by the government. Now that it's not a restriction by the government, I still think perhaps there's a role here to do a similar effort, that, you know, this is a facility that requires masks when you're indoors, you know, and some type of, you know, kind of sticker or poster or sign that you could put out front. And if there's a role for the county in helping with that, you know, I'm all ears and happy to help with that as well, because, you know, the county has tried to back up some of those efforts and have our own efforts as well.
Can I pop in? Jennifer asked a question in chat about requiring verification or requiring proof from both sides. Can a business ask for proof? And what happens if a customer asks for proof? I think that's a very interesting question. Jennifer, you want to chime in on that?
Yeah, from an employment perspective, you can ask for the card, but you don't ask for any other information. And if an individual, if a customer asks for the details on your employees, I would say no, would not share that information.
I was just going to jump in and echo a little bit of what Michael and Andrew said about, I think Michael's point about having your employees trained on de-escalation is really important, but I also think what Andrew said about a small number, because my experience in going into businesses, you know, I both had COVID and I'm fully vaccinated. And so I'm like, you know, I'm in, so I don't have to wear a mask, or does anybody else. But the experience that I've had most recently going into businesses, even though it's not required, there's no sign up and I don't have to wear it. Everybody in there has masks on still. So I kind of like pull mine out of my purse and put it back on, even though I don't have to. So I think that this is going to be a small group of people, and yes, a vocal group of people. So teaching your employees to, putting up that sign up front if you want to keep it going, and then teaching your employees to de-escalate any situation and to point to the sign and just say for everyone's safety, because we don't know, is really, really important. There was one other question in the chat that I saw. I think that, or no, I actually wanted to point out something based on what Christina said. If you allow your employees time off during work to get vaccinated, and time off for them to, if they get sick after being vaccinated, there's a tax credit that you can claim. And so that's one way that you can help share the financial burden, or that the government can help you share the financial burden of giving your employees that time off. It doesn't have to be treated in the same way as regular sick leave, and you do get a tax credit for it. And we've done that with our business. And if they get COVID, you can get a credit for that.
Here's one more question. Can businesses require proof of vaccinations of customers?
I guess I'll hop in here, and I just, that's really a function of the locality you're in. There's been a movement, there's many bills pending in legislatures across the country prohibiting that. They haven't, many of them have not passed. Locally, I'm not aware of any law that would prohibit you from doing that, but it's jurisdiction specific, and the rules are changing seemingly all the time. So continue to monitor it if you're going to go down that road. And I apologize, just so you know, I'm actually in a waiting room waiting to go on a court hearing. So when it begins, I'll have to jump off, but I'm on mute right now so I can stay on and keep answering questions.
Thank you, Mike. I think we are over, but we had one more. Peggy asked if you had COVID, how long until you can get the vaccine? And Dr. Christina replied, you should wait until you're at least 14 days from your first day with no COVID symptoms. Another question, excuse me, there were a few. What seems to be the feeling from businesses about requiring employees to return to work on site versus remote work continuation? And maybe that presidents of the chambers, maybe you guys could give a sense, or anyone else.
From a personal perspective, our employees are back. We're rotating, but all of our employees are back.
We're back.
We're not. I am.
Just anecdotally from clients I've been working with, it's a mix. A lot have been back throughout, many of which are service oriented, have been remote throughout, and they're just starting to dip their toe in the water to get back. Overall, it seems that there's a desire to get people back. For those types of businesses that have been remote throughout, there's a desire to get people back at least 3 days a week, just to have that connection to the workplace. Although everyone in those industries seem to recognize that flexibility is kind of the new reality in terms of remote working.
And I think I'll echo that. We're back, but we're being much more flexible if people need to work from home. We've learned that we can do it. But we all, my staff both are on here. We've all agreed that we like to be in the office. It's useful for us to be together. It's useful for us to have that interaction. But yet at the same time, there are times when it just makes sense, and when we can do our jobs working remotely and can still stay in touch. So I think that, you know, we'll mostly be in the office, but when necessary, we know that we can work remotely. And I think a lot of businesses will find that going forward.
Definitely. Flexibility is key. And I think employees appreciate that as well. And the communication from leadership is key also, I think. So I'm going to ask if there's any more questions. I know we're a few minutes over, but I really appreciate you guys sticking in and asking your questions. Anything else that anyone wants to ask before we sign off? I also put a link in the chat. Like I mentioned, we're doing more of these town halls. So if you have a colleague or another peer or a friend or family or someone that was unable to join today, you know, we're going to be doing 4 more of these before into the beginning of July. Feel free to follow the link, register. I want to thank Councilmember Friedson, Mike, Dr. Christina, you know, Marilyn, Allie, Jane, Margie, thank you guys so much for bringing your members here. Any last words that you guys want to share before we head off?
Yeah, I have one request. If everybody who can hear me go off or get on camera, I wanted to do a picture so we can post on social media. I think it's important for everybody to know that the chambers continue to collaborate. I know not everybody will, but if we can get on and then I know Mr. Neary needs to leave in a moment, so.
Oh, that's
Perfect.
perfect, Ally. I'm going to ask you to share that with us too.
Yep, I sure will. So if everybody can just give a big smile, I'll press print screen. I'll wait another minute. So, ready? Great. Thank you guys very much. I will send this to you, Ashley, and I'll let you wrap it up. Thank you.
That's fantastic. Thank you guys so much. I appreciate you all being here. And let us know, or your chambers know, if you need anything else, and we'll try to get the answers and connect with our experts. Have a wonderful Friday and a happy weekend.
Thank you, everybody.
Thanks,
Take care, everybody. Thanks so much.
Everyone, stay dry.
Yes.
Thank you. Save the chat. All right, I'll flip this over. Thank you guys so much. I know we'll
Yeah, thanks, Alan.
a couple people, but really appreciate it. I think that went really exceptionally well
Yeah.
I think
for an
so,
early Friday morning. So,
sure.
all right, I'm gonna pop off. Thanks,
I'll
guys.
wrap this
Thank
all up
you.
and send it over to you guys too. Just so
Right,
Excellent.
yeah. 'Cause
I'll
I
get
have
that
a few people
picture.
who didn't get to come, I think, and I'd really like to have them have it.
Yeah,
absolutely.
yep, perfect. Thanks. Bye.
Thank you.
Bye-bye.
Bye.